back to Living 808. For women living with severe migraines each month, relief might be on the horizon. Kelly went out to learn all about the new clinical trial that could change how menstrual migraines are treated.
Menstrual migraines can be intense, tough to treat, and long-lasting. But luckily, there's new hope locally with a clinical trial. Hawaii Pacific Neuroscience is helping our community, and here with all the details is Dr. Kim and Jared, who is the clinical research coordinator. Aloha, you guys.
Hi, thank you. Thank you for having us.
Of course, I'm happy to be here and excited to be learning more about this. Now, before we talk about the trial itself, first, what is a menstrual migraine, and how exactly are they typically treated?
Sure. Menstrual migraine is a type of a migraine attack that occurs around women's period, typically 2 days before menstruation starts and up to like 3 days after. So it's usually triggered by a natural drop in estrogen right before menstruation, and these menstrual migraine attacks tend to be, as you said, like longer lasting, more difficult to treat, and more intense. So they can really significantly disrupt daily life.
Okay, which of course, not fun at all. I mean, already going through the menstrual cycle, right, is terrible in itself, but to add an awful migraine on top of it, not great. And so right now, in terms of treating menstrual migraines, what is there out there for women?
Yeah, so current treatments for menstrual migraine currently just include over-the-counter medications like ibuprofen or more traditional triptans, which are the first-line acute medication for migraine, and then also sometimes estrogen-containing birth control. However, as we mentioned, that menstrual migraine attacks are more resistant to typical acute medications, so because they tend to last longer, so they are limited.
Oh, okay, good to know. And so it doesn't sound like they're super easy to treat.
Right.
And even so, I mean, when it comes to actually trying to treat them, that's a lot that you're putting into your body as well. So I'm excited about this clinical trial. Can you share a bit more about it, Jared?
Yeah, so just generally speaking, it's a 24-week trial. It's studying the safety and efficacy of a medication that is already FDA approved for treating migraines, but not necessarily for menstrual migraines just yet. And then hopefully we can give these patients who, typical medications like ibuprofen just don't necessarily work as well. Hopefully this is an avenue for them to try a medication that might work for them.
Wonderful. And so when it comes to, especially a new medication, I think people, are curious about potential side effects. So what should people know that are considering it?
So it's a CGRP antagonist. They are actually specifically built for migraine treatment. They block this effect of a protein called calcitonin gene-related peptide, the CGRP, which is a key driver in migraine pain and inflammation. And it's actually a safer option for people with vascular risk factors or vascular disease, because they don't work by constricting the vessels, unlike the traditional therapies like triptans.
Okay, good to know. And when it comes to migraines, I think for so many people, they can be so debilitating. And so this, I think, is giving a lot of people hope. So if people are out there and curious, oh, could this trial be for me? Who can be candidates?
Yeah, so really anyone who's over the age of 18, isn't pregnant or wanting to become pregnant in the foreseeable future. And then it's just people who have migraines during or slightly before or slightly after their menstruation. That's about 2 to 3 days before and after. So those are typically the candidates that we're looking for.
Okay, and if that sounds like some of our viewers, if people are interested and excited about this, where do we go for more info or to sign up?
Yeah, so they can call us directly. They can call us at 808-564-6141. And then they can also go onto our website for Hawaii Pacific Neuroscience. That is hawaiineuroscience.com. And then we have a page strictly for the menstrual migraines.
Awesome. All right. Well, if this sounds like it's something that would interest you or someone you know, of course, we'll have all that info on our website as well at KHON2.com. Thank you so much for joining us, you guys.
Thank you.
And wishing the best of luck. I'm excited to see what comes out of these trials.
Yeah, thank you so much.
Interesting stuff, and exciting that this trial is happening here in the islands. So again, if you're interested, make sure you reach out.
I know how difficult it is. I've dealt with migraines since I was a young child, and so I get it. Can't even imagine how big and how hard those are, because I know what that feels like, and it's not fun. Yeah. Good stuff. Thank you.
Yeah, great stuff. And again, we'll have all that info online. All right, so much more coming up next.